Hi everyone, welcome to HLSC 3800. We are starting Module 1, Health Promotion and Planning Models today. And remember, this is going to cover Chapter 1 in your textbook as well as sections of Chapter 3. So be sure to read those sections in your textbook. Alright, so let's get started. So for this course, we will be practicing our health promotion skills by planning and developing a health program or an intervention. So you'll be developing your own health promotion program, which is super fun. I was in this major as an undergraduate student, and I also took this class and developed my own program. So I've been in your shoes. It's not the easiest course, but you get a lot from it, and if you go with it, it can be a lot of fun too. All right, so we're going to be planning and developing a health program focused on adopting and maintaining positive health behaviors. So you will be assigned a health topic and a population, and you will have to develop a program for that population and that health topic. We'll go over that a little bit more in the Module 1 overview video, so be sure to check that out so that you know where to find your topic and how to get started in developing your program. All right, so let's talk about the types of professionals that are within health sciences. So you may be thinking, well, I'm not going to be using program planning. I'm going to be doing something different in health sciences. I'm not going to, work for a nonprofit or be, having these job responsibilities. But you'd be surprised. Anyone in the health field, health sciences, has some aspect, some involvement in program planning and development. So let's take a look. So we have our health promotion, health education professionals. These guys are the ones that are on the front lines. So they're going to be the ones developing these programs, planning them, evaluating them, and they work in community centers. They'll work for schools, all different areas. So these are those frontline guys that will be using this the most. However, like I said, any person in the healthcare field will have their feet in this program. So let's talk about administration. So this can be healthcare administration. This could be administration for different companies, CEOs, those guys. And they're involved in the management side of programming. So maybe you have a health educator coming in to implement a program, but these guys will be kind of some of the decision makers for those programs. So it's important for them to know what's going on. They can kind of manage the resources, manage the personnel, and be a part of those activities. Therapeutic services. So you can think physical therapists, occupational therapists, chiropractors, pharmacists, dentists. They sometimes play a key role in some of these programs because they are involved. Maybe they're part of the activities that are in these programs. So they are also included here. Diagnostic services. So you can think x-ray technicians, ultrasound sonographers, any of those people that are in diagnostic imaging and services like those. They can also play a key role. They help understanding the health status of our individuals. Perhaps prior to programming, they need to have some sort of screening done, or perhaps that is what the program is all about. So increasing the use of mammographies for women to reduce the risk of breast cancer. Obviously, those techs that do the mammographies are going to be involved there. All right, health informatics. These individuals are going to be getting us the core data that we need. They're going to be pulling medical records and looking at documents that help pull information for these programs to be evaluated and to be assessed. All right, guys, so next would be our support services. And these individuals, think about maybe some of our certified nursing assistants or some of our patient care technicians that work in like long-term care facilities. Think about if there's a program for fall prevention for elderly. They may be the ones that are helping implement that program. And then last but not least, we have biotechnology research and development. Right now you can think about our current times. We have COVID going on, and there are people in biotechnology that are trying to develop a immunization, a vaccine for COVID. So they have the most information that we need, and they'd be key individuals to include in a program to increase vaccine use once it's available to the public. Okay, so all of those health science professionals, what they do is they provide information, design, and provide programs and services, initiatives, campaigns, and materials to promote healthy living. They do so by following these different categories listed here. So epidemiology surveillance. They monitor trends and track progress. One thing we can think about right now is tracking COVID, right? They're looking at the trends, tracking progress, how many new cases in a day, correct? Policy, environmental policies. These promote health, support, and reinforce helpful behaviors, like texting and driving. That is now a law that you cannot text and drive, right? So implementing policies like no smoking on hospital campuses. That's a policy that helps promote healthful behaviors. Health systems interventions, so improving delivery and use of clinical services and improving delivery and use of preventative services. So improving the use of screenings, so cancer screenings, mammographies, things like that. Improving the use of our clinical services. Healthcare is super expensive. We spend so much on healthcare in the United States. It's ridiculous, but improving those services so that we are getting ahead of these chronic diseases and ahead of people getting really, really sick, and trying to get them to use those services, like going to their annual physicals and things like that. And then community programs, improving and sustaining management of chronic conditions. So trying to change behaviors through community programs like diabetes education, and increasing physical activity, increasing the intake of fruits and vegetables, different community programs like that. Okay, so I want you guys to take some time to think about, why do we need health programs? Make a list. Think of all the reasons that you can think of for why exactly we need to develop, and implement health promotion programs. Okay, so did you write something down? What did you think about? Why do you think we need health promotion programming? Well, we need to respond to the need for health promotion programming. We need to promote behavior changes. And it's all to prevent and delay the onset of chronic diseases. So let's talk about responding to the need. How do we know there's a need? What is the need of the American people? So back in 1979, there was a document published. It was called Healthy People, the Surgeon General's Report on Health Promotion and Disease Prevention. It was actually the original Healthy People document. So you've probably heard before of healthypeople.gov. It's a website. But what it does is it gives the general public health information that is understandable based on evidence-based research. So they gathered all this research and they said, hey, these are the things that people need to change to be healthy. This is what our American people are struggling with. This is what is making them sick. These are the things that we can change and implement to be more healthy. It was the first set of health goals and objectives for the nation, and these were published shortly after this document. And every 10 years now, we have new goals and objectives for the United States, and they're published, and they're easily understood by the general public, which was nice. Prior to 1979, there was research going on, there was documents being published, articles, journals. However, it wasn't easily understood. It wasn't written in a way that the general public could understand. And this kind of changed all that. So now it's accessible, and we can understand how we, as normal people, can change our health behaviors and what things need to be changed. So as I mentioned, chronic diseases are a big focus of health promotion programming. A lot of times it's to prevent chronic diseases, but sometimes it can be to manage chronic diseases as well. So what is a chronic disease? A chronic disease is any disease lasting 3 months or more that cannot be prevented by vaccines or cured by medication. So one example is diabetes. It cannot be cured completely. However, like by medication, it cannot be cured by medication, but it can be managed by medication. So I just want to make that clear, because some of you might think, well, I know someone that has diabetes, but they manage it through medication, so they don't really have diabetes anymore. That's not true. They still have diabetes. They still have the chronic disease. So chronic diseases are very common in our day and age. Most of these are preventable. They usually lead to a long course of illness, right? So individuals, keeping on with the diabetes example, individuals with diabetes can develop neuropathy. They can then lose limbs due to the reduced feeling in their feet and hands because they don't realize that maybe they get a cut. Maybe they have ulcers forming and it gets infected. They don't really realize it and it gets too late and they lose their limbs. Diabetes can wreak havoc all over your body, causing lots and lots of different things to go on. So it is a long course of illness, and this goes for any chronic disease. They usually develop slowly, and they progress over time. So some of our biggest ones, biggest chronic diseases are heart disease, diabetes, and cancer. These are our big three. All right, guys, so we're talking about chronic diseases still, and these are the leading causes of death and disability in the United States. In 2010, 7 out of 10 causes of death were from chronic diseases, things that could be preventable. 2 of these, both heart disease and cancer, together they accounted for 48% of all the total deaths in 2010. This is crazy because, again, we said that these chronic diseases to some extent can be prevented, right? Heart disease can be prevented by healthy behavior changes. So let's talk about those, these health risk behaviors. So what is putting us at risk for these chronic diseases and ultimately killing us and, causing a shorter lifespan? These are unhealthy behaviors that can be changed. And there are 4 of them that cause the most illness and suffering and early death from these chronic diseases. And those 4 are lack of physical activity, poor nutrition, tobacco use, and drinking too much alcohol. So the good news, like I said, is that these behaviors can be changed, right? With health promotion programming, things like that, policy changes, we can change some of these health risk behaviors. So there is a need for health information to be understood by the average person. Not all health information is easily digested by the general public, so we need to make that easily understood for them. Health professionals to provide the public with information and skills to make quality health decisions. We have to give individuals the skills and abilities to make the right choices, right? And programs help people adopt and maintain healthy behaviors that help prevent or delay the onset of these chronic diseases. So it's not easy. It's not an overnight change, right? You can't just a lot of times say, I'm going to eat fruits and vegetables with every meal and just make it happen, right? These are small changes that have to be implemented and maintained over time. So programs help do that. They help people adopt and maintain these behavior changes. And primary health risks today are lifestyle, behavioral related. We have to help change these behaviors.